Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 Hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola bringing you yet another Fast Facts Pharmacology Edition. Well, our first edition was about medical histories. So again, going with our theme of starting from the beginning, what should be our next step in working pharmacology into our daily practice? Well, I'm going to say vital signs. And people say, wait a minute, vital signs? That's not pharmacology. Well, yes it is, because I need to know the patient's vitals so that I can see if their medications are doing the job they're supposed to do. And also at the same time, that helps me make good clinical decisions on not only will they be compliant with their medications, will they be compliant with treatment planning and home care. It gives me a sense of the patient's buy-in, if you will, into not only their overall health care, but their oral health as well. Okay, Viola, what kind of vitals? Well, I can't say this enough. Obviously, blood pressure. Now, wait a minute. I don't have time for this, Tom. I mean, taking blood pressures is time consuming and I don't have a lot of time. I got to put on 50 layers of PPE. I got to fit people into appointments and get all the job and then clean up, and it's too much. Understood. But there's always time to take a blood pressure. Find a way. Why? Because it's so important. It's probably the most important vital you can take because it helps you understand overall the patient's systemic health. So resting pulse is important, but blood pressure is even more important. Now, I know what you're going to think, and I would say the same thing. There's that white coat syndrome, right? Patients' blood pressures are elevated when they come to see me in the dental practice. Well, it's very true. Okay, I don't know if we all wear white coats, but true that a dental appointment is stressful, and therefore patients have this natural surge of endogenous epinephrine, adrenaline, and that raises their blood pressure and pulse. But to be fair, over time during the appointment, that should settle down. And if their blood pressure is still elevated, I want to know why. I've often said to my audiences who hear me speak, there's no good reason, but 3 good excuses why a patient would have elevated blood pressure in your chair. When you think about it, everyone should have normal, stable blood pressure, right? If they don't, there better be a good reason. Well, there is no good reason, but here's some excuses. Number 1, they have blood pressure medication, but they don't take it. Number 2, they have blood pressure medication and they take it, but they take the wrong one. Or number 3, they have hypertension and just don't know it. And that's, I'm sure you know, the more common or the more likely scenario. So here's how hygienists, dentists, all dental professionals save lives. By you taking that patient's blood pressure, you can identify if they have hypertension before they even know they have hypertension. And more importantly, you can make important decisions in their treatment planning that will help alleviate their hypertension, keeping them calm as well, but also averting potentially a medical emergency. All that because you took their blood pressure and knew exactly what that meant as far as where they are in the world of hypertension. Pulse is important too, right? I want to know if the patient's heart rate, resting heart rate, is elevated. Why? That gives me a good sense of what their overall cardiovascular fitness is, but it also gives me an idea of what their stress level is. Maybe we need to prescribe a benzodiazepine or some other procedural anti-anxiety drug if their pulse is very high due to the stress of the dental appointment. What else? Respirations, okay? Especially in the world of post-COVID-19, I want to know if you're breathing well, and therefore can you handle the stress? Do you have the functional reserve? Can you use oxygen efficiently and effectively in withstanding stress during this dental appointment? And I also want to know about A1Cs. If you are indeed pre-diabetic or diabetic, what was your most recent A1C? Because that's going to lead me to make some decisions and conclusions about what I'm going to see in your mouth when I see it. Anything else? Well, yeah, temperatures. Because we still live in this post-COVID-19 world, And I still would like to know what your body temperature is so that I can make some decisions that way as well to determine if you're even fit for treatment today. So I know this doesn't really land in the realm of pharmacology directly, but indirectly, by knowing a patient's vital signs, you can tell if they're compliant with their medications, and therefore you can make some good decisions about their care and use pharmacology to your advantage. So looking forward to seeing you all again in our next edition. Thanks so much. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.